So for this handsome patient, what we're really looking for with the thread lift, which is a non-invasive facelift, and it's often called the silhouette soft lift, or in the old days these thread lifts were just little tiny sutures placed right below the skin. But the contour along the jawline, you can see there's some laxity here, but not ready for a facelift yet, and just a little bit of hanging here. So what I'm looking at when I do this is if I'm picking a single point of elevation, what's going to give me the best result along his jawline. And he's had a couple placed previously for the mid face, and we really want to go parallel to those because the vectors are all pretty much straight back. So if I do a finger here, this is going to help. If I do a finger here, that's going to help. And it's an 8 centimeter length with the 4 cone. So if I lay that on there with a marking pen, I can see not only the vector but the full extent of the device when it's deployed. So I'm going to turn just a little bit here so you can see it better. And at 8 centimeters, or the 8 cone, we can see the 8 here. And the exit point doesn't really matter because it's the cones that hold it. We just don't want anything coming out. And again, I'm looking at single point elevation. What's going to help his jawline the best here? And if I pinch this here, you see I'm going to get a better result than if I pinch up here, single point. So really right along this zone of the jawline is where I'm going to get the best lifting effect. And we're going to distribute this over a bigger area, so we're not going to get a pinch like you see between my fingers, but we're going to get a good improvement. And we want to avoid any of the centroneural structures here. And that's 8. And if I go all the way down to the jawline, right at it, this is the exit point. We can go sooner than the exit point, but we want the 8 cones there. This is 8 here, so a little further back. And the idea is a lifting effect, right? And this is, if I draw out where his jawline is, this is the jawline right here. And then the angle of his jaw is right here. So we call that the angle of the mandible. And we want to stay, in fact, it starts to slip down a little lower here. So we want to stay above that, but right at the jawline to get the maximum lifting effect. So I did the 8 centimeters, and I'm showing these as dots sequentially along that vector of pull that I've created with my finger. And we really want to see where that lift is the best. And it'll be coming out somewhere along here. And it looks like, it's somewhere in this zone right in here where I'm getting the best lifting effect for the jawline. The beauty of this is it creates a fibrous network of little bands. I draw that right here too. Little bands of connective tissue that actually help to keep the suspension for the long term. So if I go down all the way below his jawline, I won't see as much lifting. But if I go right at it or slightly above it, I'll see the maximum lifting. So that's really what we're looking for, minimum. And then the higher I go, I'm going to affect it less. So it ends up being these middle lines, and it really is a finger that represents what the thread can do in terms of definition. That's where we really want to see the most definition. So we'll start the procedure with a little local anesthesia. Okay, so just to refresh, this is the jawline here I've marked. This is the angle of the mandible. We're looking for jawline definition. I've taken several different points and lifted them to see which gives the best effect here. This is right at the jawline, not a great effect. I can come a little farther forward. This is a little above the jawline. You can see that vector is really doing the most movement. If I go up above here, it helps too and smooths things out, but definition of the jawline is important at this point. So I think in between is really where we're going to see the best definition of the jawline, which is what he was looking at. And with different angles are going to give a different result. We really want a straight posterior vector. So we're going to start with a little drop of local around the entry and around the exit points, a little pinch here. And this is done sterilely, so we're in the operating room, but we don't have to use that. We're going to have an entry exit point right here. And I'm going to do a little drop here in the front. And that really is pretty much all the local you need, but I'm going to come right along our track with just a small injection just so you didn't feel any discomfort with the needle. And are you feeling any of those?
Not much.
Not much, good. So, after that, that'll just make it nice and numb. Okay, so this is the center of our lifting device, and you can see there are cones that are narrower on the upside, if you will. And if I track my little clear suture that's dissolvable up, you see a long needle here that we're using. And on the other side of the cone, you'll see, or the other side of the device, you'll see, of the midline, you'll see cones with the point that are going in the other direction. And so what we're going to do is insert, sponge there. We're going to insert from a little puncture point here and go up this way, and the cones will slip through easily because their narrowest point is in the direction of travel, but they'll resist going back because of the wider cone. All of these are dissolvable, so they don't stay there forever. And it's the same thing when I go in from this point and out to our distal mark, or part farther away. I'm going to be able to lift and engage the cones on the lower part, and then I'll lift and pull upward with this. And once I get the desired lift effect with these upper cones, I just trim the suture. Some people actually are sewing that to the fascia, and there's different things to do where you have to make incisions. The whole purpose of this is to stay without incisions, so we're going to do the minimally invasive approach with no incisions, or very, very small, just a little puncture in just a minute. So we were just sort of testing, because the jawline improvement is not bad if I go with my bottom dot line here, but the one that seems best, and it improves this labiomandibular sulcus here and the jawline, it's this lifting effect here. So this is the middle, midpoint where the little incision will go, and I'm going to make it between those two dots here. And it's really about halfway between these. Anything sharp there, Greg? Anything sharp there?
Mm-hmm.
Take out that angle in a second. Lines and relax skin tension. Vertical. So I've just made a tiny little puncture. You can do that with, and I usually don't have it on the field right now, but an 18 gauge needle is totally fine to make that little incision. And I want to make sure it's into the fascial layer. That's where we're going to get the strength, and then you can see that little puncture, and I've dilated it just a little bit. And then the entry and exit points are important. I'm going to do this so I don't get in the way of the camera. So I'm going to pinch this up, and we want to get into the sub Q. And then we're going to just run really straight parallel with our little needle there. And the deeper sub, I don't want it to grab anything. So it's the deeper sub-Q tissues. And we're going to exit in or around our little point here. And for me, I think it's better if we avoid definitely want to be above the jowl. You want to be lifting that. So once that's through, I'm going to See the little, now you can see the little cones. They're oriented so that there's very little resistance. A little bit, but not a lot. And then we're going to come back. So we're going to be ending up trimming that wherever we feel it's appropriate because the cones are engaged now. I'm going to do that same thing on the other side. And the important part about this is that I'm doing it in such a way and I'll just have you hold this out of the way. So I'm doing that in such a way as to avoid the stitch down below. And I can see my track here. The deeper fascial tissues are our target to do the lifting. And I'll come out in the thicker skin here. The bearded skin really is the best place. We're going to be well below the skin surface, but you'll see the lifting effect in just a moment here. So I'll put my thumb there to act as a guide, so we're coming out perpendicular to the skin. And really the key here, making sure he's got one of those in his eyes. Hiccups. I want them all to be tracking in the right direction here. So now I know that's going in cone head first. So I want to be careful with that. I don't want to pull it all the way through. But I have really now the two ends that are, and I haven't fully engaged these yet. So the idea is to be positioned well with the little cones. And so I'm sort of swiping my finger over those and making sure that the skin here, the skin tissue, is really backed up. If you think about it, I'm trying to push it against the cones while I advance these. And the more I advance these, obviously, the more the cones are going to be lifting. So I'm going to continue, and if I see a little bit of a cone coming out here, that's okay, because we don't need every one of them. We want to have as many as it's required to get the lifting effect that we're looking for. And with each little lift or tug, I'm getting that advance that we're looking for here. So I've lifted them quite a bit already. And if I let that go, you see it's holding that point. My little knot here indicates that there's a cone nearby. And so we're going to make sure that if I need a little bit more cone, I can get it there. So this was almost going downward before at the corner of the mouth. And the lifting effect you can see there, there's no incisions. That's the key thing. It feels like they're all really fully seated, which is really what I want to make sure that I've advanced these all the way, and they won't go back once I've got them seated in here. That's really good resistance to any advancement of the soft tissue. So that basically this is holding this up. And it's the one of the reasons that people use the suture. They'll pull up even further, and then they'll sew this end to the fascia. But again, this is the non-invasive approach. We're not making incisions to do that. So that's down below the skin surface. There's one, that's probably as far as you want to go. Now you don't, there's no stitching required here, but I like to put one little eversion stitch in the middle. It's just dissolvable. It's a 6/0 and it comes out quite quickly. So the principle, it doesn't look, it looks like a hair, so people, you don't even have to notice it. But the idea behind that is to make sure that I'm closing the skin away from the little suture that we place below the surface. And that's why that little tunnel that I showed you earlier, the dilation of the tunnel, is so important. I'm going to draw the jawline here, as I'm doing my palpation, my feeling. And then the idea is to find the best vector. I'm going to do single suture techniques. I'm going to really lift that and move this side's drooping a little bit more. So I really like that vector pull. You know, I'm going to go straight posteriorly, but if I'm going to keep my fingers out of the way here. So if I go at the jawline, there's this effect. If I go just slightly above it, this is where I'm getting this extra skin that's sort of sagging downward. And so that's the little line that we're looking at. I'm going to do my 8 centimeter. I can't go below. I don't want to go below this marionette line because that would make that marionette line worse if I were pulling it up from there. So my exit point has to be somewhere in this area. And then then I look at the inferior exit point, and I'm going to lift again just to see the best vectors pretty much straight back from that line. And I say midpoint, but you can go out beyond that. 4 centimeters is where the middle of the device will be, and then 8 centimeters here, and then we can even come a little bit beyond that to make sure that we get all of our cones. If I go 9 centimeters at the center point here. So somewhere in that zone here, right in between here and here is where we want the entry to be. So I'm going to draw my little dots, but I just want to show the vector of lifting is here, and really looking at this marionette line, or the line by the jawline is what we're going to be lifting. Of course, I'm not going to get all this stuff that's happening with my finger here because it's all happening below the skin surface. I'm going to go with the lines of relaxed skin tension, which I can see are vertical on him here. So these are very well hidden. And of course these sutures are all dissolvable, so whatever we will get fibrosis around them and the cones, and there's a lot of feeling that the little band of fibrous tissue that's left surrounding the little cones is something that gives a sustained elevation. That hasn't been proven yet, but a year and a half was about I think what the package labeling gives for this lifting effect. And for many people that's a great alternative to doing a surgical lift. And I think younger people, like our patient here in general, are going to get more dramatic results than someone that truly has a lot of redundant skin and jowling. It's just not going to work as well. It won't be as profound of an effect that they get. Yeah. So this is an 18 gauge needle, really is all you need for the incision. Just make that little needle. Make sure that the little sutures in the sub-Q below the skin, or any other above. I'm going to make sure when we do this that we're using the cones. They're unidirectional cones, but the device is bidirectional. So if you want to come in here and zoom in, I can show you this a little better. But these are the little cones, and can you see those clearly?
Yes.
So you can see that what holds them is a little knot. So right now they're falling again, two little knots. There's one above and one below. But the cone, tip of the cones is all with the lower half. This is the lower half. This is the middle point here. When I insert it, once they're going to slip through easily because the cone's tips are on this side. In this direction, they'll slip through easily, but there'll be resistance to them coming back up, which is what gives the lift. And then I'll do the same thing with the upper one, pull it through as far as we can, and then the cones will resist going back down. So that's how we get the lifting effect there. As long as we're out beyond the, and we can even go beyond the line here with the exit point, because the cones are going to be distal to that point, but really that's very close. So the main thing in this part of the, I want to get the light right so I can see, you can see it clearly here. So I'm going to be vertical here. Doing a little, just a little poke with a needle as a numb down into the deep fascial tissues, and then following parallel. And I'm going to stay in those deep fascial tissues. There's a plane, you can feel it really. And then the exit point here is going to be above that marionette line. Or it can be slightly below, as I said before. These cones don't come out exactly. There's the tips of the cones they're going to go through. Can you hold on to that for me? You don't have to hold it tight, just slacken it. And then I'm sort of working those downward so that they're fully engaged. And I don't see a little knot, that's good, so that means all of them are engaged. And that's about as far as I want them to be. As soon as you see your little knot, that means that's where the last little cone is. So now they're engaged fully. And if I lift this, you'll see the effect is to give a little pull or elevation right at the skin. And if I were to see some dimpling, I would work that cone a little bit more so that it actually gives a lift that's uniform. So that's really the effect of lifting that we're looking for here. And we're going to do the same thing with the upper one. I'm going to grab this right here for me. And I'm going to pull it inferiorly. I want to just stay away from that with the sharp needle point there. You don't want to hurt the suture itself. And it's going to go down into the fascial tissues. Okay, here we go now. And then I'm going to direct this exactly along that plane that I've already predefined. And my 8 centimeter dot is right there, so I'm going to come out just slightly above that. Is there a little pinch there?
Mm-hmm.
So I'm going to give a little drop of open so we haven't feel any more pinches. So again, it's working these little cones and making sure that they get sub-Q. And I'm going to kind of pinch the skin up a little bit too. And then just continue working that until these are fully engaged. With the lifting effect that's below, you can see that I'm making little notches at a time. I've got a little bit of A little bit of dermal adhesion here, so I'll work that out here as we do this. So I'm going to take that. So if I see a little bit of, if you'll pull you give me a little tension on the other side. So I'm going to lift that skin, make sure that this is free of any dermal adhesions. And then I've got the lift. You can see it already, the lifting effect here. And I make sure that all those are fully engaged in the tissue there. All above the knot. And I'll trim those two ends. So that'll be well below the skin surface. And the same thing here, it's going to be well below the skin surface, and that knot can be trimmed because it's not doing anything, right? The upper knot, if we don't need that cone, we're not going to use that cone. But you can see it's holding a nice jawline contour here.